Senior Consultant with ReportMaster Software. In our last video, we talked about goals, short-term versus long-term. Goals for today's treatment as compared to goals for the treatment plan, which could be over a 2 or 4 week period. It's very important that you include both in your notes, especially if you're doing any Medicare, but also for any insurance, and really for any good documentation that you need. Now, we're going to talk today about a term that you may have heard called clinical endpoints. In other words, and I may be using this term a little more loosely than it's normally used. What we're really looking at is goals that you can have that are measurable, that show something you're trying to achieve over a period of time, like let's say a 2 or 4 week period. Something that's measurable, that shows so that you can actually say, I'm trying to achieve this, and when you've achieved it, you can show it in a measurable way. And we're going to take a look at that, as well as using disability indexes for the same purpose. All right, let's take a look.
All right, here we have the screen where you input the treatment plan. Here we have what care phase is the patient in, what's the frequency and duration of treatment, what are we going to be doing over that time, what are our goals, why are we doing it. You notice how it's all blank right now. Well, I'm going to hit the No Change button, which pops on the screen what we had last time. The patient is in a relief care phase. You're seeing the patient 3 times per week for 4 weeks. You're doing moist heat, physiotherapy, EMS, and adjustments to decrease pain, increase ability to perform activities of daily living, and return the patient to her pre-accident status. Well, why don't we add a goal that has a measurable quality to it? For instance, I'm going to hit this auto codes button here, and let's say we want to say an additional goal for this patient, or for this treatment plan, is for the patient to be able to walk without pain for 90 minutes. And here we have one for 120 minutes. So let's say that's a particular thing you want to add. I'm going to hit insert code, and now you'll notice how it just popped it in here. Now, you could just as well have written it in here, but if it's something you're going to use from time to time, for different patients, you could have it as an auto code that you just click on. Now, next note, if I hit the No Change button, this will pop in here as well as everything else coming up on the screen. So you hit the No Change to pull everything on the screen, but then you can make it change very easily if you want to. Now, just as another example, one of our clients talked about having a goal down here. Now, bear with me here. I'm not a doctor myself, but I believe it was the monopedal Romberg test. It's a one-legged Romberg test where the patient, I think they try to balance on one leg for a certain period of time, and his goal was something like to have the patient able to perform that test for a certain length of time. Okay, there you go. It's a measurable thing. If they haven't been able to do it initially, then to have that as a goal for your first re-exam, it's a legitimate goal. Another example perhaps might be to have one of the one of the disability indexes like Oswestry hit a certain number. Let's take a look at that. Actually, I'm going to go back into this chart and show you how you can do that with ReportMaster. We're going to go to we're actually going to go to the initial visit for this patient, and on the initial visit, let's actually just go to current symptoms, first current symptom. Now, there's a lot of data you need to get initially when you see a patient. Now, with our system, there's a questionnaire. The patient just checks it off. Very easy to input. But this is the patient's neck. It's left side. It's a dull, aching pain. Hurts up to 3/4 of the time. Prevents activities. Does it radiate? Yes. To the shoulder on the left. What actions affect it? Twisting left and right. Aggravates it. This is B is brings on, A is aggravates, R is relieves. So those two aggravate it. Sleeping relieves it. But what if you want to do the Oswestry? Now, we don't actually have the Oswestry here to check off, but a lot of our clients have the questionnaire that they have the patient fill out. And actually, one of our clients who lectures for NCMIC for their, I think they call it documentation and liability seminars, actually prefers to have the questionnaire checked off by the patient and signed and dated by the patient. So there you have proof that the patient was there, that they checked it off. If it was ever questioned, you can pull it up, and their signature is on it. But in his report, what he'll do is he'll do something like this. I'm going to hit this auto codes button, and here we have symptom, Oswestry. And this is going to say the Oswestry pain questionnaire, which helps determine quantitatively how a patient's symptoms are affecting his or her activities, was also filled out, and today's score is, okay, so now I'm going to hit the insert code button. So now here we have that auto code, and all I'm going to do is right here just put the number. Let's say today it was a 52. So I'm going to put a 52 and a period there. So now in the report itself, here we have the initial report, and if I go down to current complaints, an assessment of Ms. Winslet's current signs and symptoms was performed today. Her first symptom is dull and aching pain in the neck on the left side. She reported the pain radiates into the left shoulder. It occurs between 1/2 and 3/4 of the time when she is awake and precludes carrying out activities of daily living. It is aggravated by twisting to the left and twisting to the right. Some relief is experienced by sleeping. The Oswestry Pain Questionnaire, which helps determine quantitatively how a patient's symptoms are affecting his or her activities, was also filled out, and today's score is 52. Now, if they ever needed to see the raw data, you could supply it to them, make a copy of the actual form, or you could even have it as an attachment to the report. Okay? But this gives them the actual data. Now again, for your treatment goals, though, you could actually have some prediction of what you'd like to achieve with one of these disabilities, like indexes like that. So that's really what we're looking at here. How to have some things in there that have measurable. In fact, what about range of motion? Maybe you want to improve their range of motion to a certain point. Well, again, you could have that as as one of your goals for the treatment plan. All right. So that's a little bit of what we're talking about now, and stay tuned. In fact, let us know if there's a particular topic that you'd like us to discuss, and we'd be happy to. All right. I'm Randy, and thanks for listening.
Please give us a call today, toll free, 877-742-9215 for a live demonstration. Thanks.